Good afternoon, students. Today we are going to discuss on the National Leprosy Eradication Program. And at the end of the today's session, the learners are expected to have an overview of this very program, National Leprosy Eradication Program, to have a look for the milestones of success for elimination and eradication of leprosy. And in this context, three definitions are very much important, that is the control, eradication and elimination. We have to know the objectives of the program, strategies of the program and the special activities to activities related to this. One thing here comes from the examination purpose, that is in our grand viva examination, a tray, the examiner have some equipments, materials in the tray, and for the leprosy they keep the multi-blister combi pack, empty multi-blister combi pack, that is for the multi-drug therapy. And the questions usually come that take this one, then what is this? You have to identify which is this one. In this manner, that is, it is the multibacillary adult or possibacillary adult or possibacillary child or multibacillary child. Then automatically the question may come, that is, what are the drugs that are there in this one particular? If it is the multibacillary adult, then it is the dapsone, rifampicin and clofazimine. Those may or may not be asked, that depends on teacher as well as the student. And then under which program it is covered. If it comes as the long question for the leprosy, it may be given in the form of a linker case. That is a case vignette. A person aged 25 years have visited to your outpatient department with complaint of some hypopigmented patches. Say they have mentioned that is the 7 hypopigmented patches, 2 over right hand, 3 over left hand and 2 over the abdomen or legs, whatever may be. How you will proceed for diagnosis, what may be the differential diagnosis may be there, or under which national health program, how to manage the patient. Then as per the pro forma, we have to write down, first we have to go for the taking the history, and then we have to discuss the drug management, patient management, that is the detection and treatment, and along with the treatment some rehabilitative measures. That is very much important for leprosy, because leprosy is the disease condition, we all know that, that is responsible for causing disability and long term deformity and long term disability. So keeping this in mind, while we have to write down the objectives, it is not possible for us to memorize a number of the objectives for the different programs. If we can understand the program, we can make the objectives and accordingly the strategies for the, because the ultimate aim to this is prevention, management and control. Keeping this in mind, we have to make our own objectives, own strategies. That is, objectives will be there, but to be in our own language. That is, if it is in case of leprosy, of course, the objectives are the early diagnosis, management, then may come, that is the rehabilitation, and one very much important thing, that is the awareness generation and destigmatization, because leprosy is the disease as it produces deformity because of the loss of the organs, loss of the different body parts, so that person some people have some stigma, some felt stigma, some actual stigma are there. These are the broadly objectives, and so for this to fulfill it, broadly objectives, yes, for fulfilling these objectives, what strategies may be taken? We are just making it our own thing, that is the strategies may be, the camp system may be there, it may arrange for the dermatology camp or the camps where the specialist as well as the MBBS doctors will be there. maybe their house to house survey by our frontline health workers, ASHA, ANMs and Anganwadi worker. They will go and examine the people randomly, and they will find out if any one of the patient having any suspected lesion, that is hypopigmented hypoesthetic patch, and then and there have to refer that patient accordingly. Another thing may be the rehabilitation. Then one thing, that is the patient is diagnosed to have the leprosy, it is necessary to initiate and continue with the treatment, and finally the treatment completion. That because in case of the leprosy, in the leprosy class itself, we have seen that treatment completion rate is one of the important indicator. Treatment fault or the drug defaulting is very common in these diseases like leprosy, like tuberculosis, these conditions, because the drugs are notorious to produce a number of the side effects. Another thing is the lepra reaction, that is also very much annoying for the patient. Then once the treatment acute condition is over, patient become non-infectious, what is more necessary, that is the disability prevention and medical rehabilitation, DPMR. DPMR is an important and integral component of the leprosy management itself. If the permanent deformities are there, there are some curative surgeries like as the reconstructive surgeries, provision of some aids like as the special spectacles, ophthalmological operations, and another thing is that is the provision of some microcellular rubber footwear chappal, MCR chappal. Then for the leprosy patients themselves, there are some social security schemes, that is Antodaya Anna Yojana. For them, the leprosy affected people, once the patient were ex-patient of leprosy or current patient of leprosy, once they have become detected having leprosy for lifetime, they will have this special social security schemes, that is provision of some cereals, grains and garments under this scheme. These are the overall things that we can write down from our own things. So to start with, the National Leprosy Eradication Program is a centrally sponsored health scheme of Ministry of Health and Family Welfare, Government of India. Another important thing is that when the question will go following the leprosy program, then three definitions they will must ask, that is the what is control, what is eradication, what is elimination. These three concepts we have to make clear. Control, that is the disease itself is not a public health problem. Eradication, no person to person transmission is there, and elimination, that is the disease is no new case is occurring in the community, and after that there comes the extinct, that is the disease causative agent is no longer, that is one thing. That but up to this, that is control, eradication and elimination, we have to remember. Plans or strategies as usual are framed centrally, but the program is rolled on at the state and union territory level. Of course, up to it is the bottom up approach, that is the disease reporting, case detection started from the most periphery area, that is from the subcenter level, not also the subcenter level, from the village level itself. And then from there the patients, the suspected people having leprosy are referred to the doctor, medical officer. If the patient is, because the diagnosis of leprosy is a very clinical one, slit skin smear examination have no value in program management. We have to keep it in mind from program management point of view, slit skin smear examination have no value. Only we can see, that is the number of the skin lesions and number of the nerve involvement. And according to the national program, that is the National Program for Elimination of Leprosy, National Leprosy Eradication Program, following this there are the two categories, paucibacillary and multibacillary. No question of Ridley-Joplin or other classification. According to the World Health Organization, there are the two categories of the disability, that is if there is the no visible deformity, then it is grade 1, and if visible deformity is there, there is the grade 2. And for leprosy, the monitoring and supervision surveillance plays an important part. From the peripheral level itself, a number of the forms are there, that is LF01, LF02 and P1 to P5, P1 to 3, 4, 5. These are the, in these forms, in the practical class, we will try to demonstrate you these forms and how to fill up this. At least you will have some idea on these things, and of course the multi-blister packs of MDTs. Then these forms are filled up at the point of initiation of the treatment, detection and initiation of the treatment, and later on, time to time, on monthly visit, the patient is followed up with filling up the form. The form is framed in this manner so that according to the date, there are the options to give the tick and to fill up the form. There are also supports from the World Health Organization, International Federation of the Anti-Leprosy Association and different other NGOs, other non-governmental organizations. For the leprosy, as we have all read, that is, the leprosy is one of the most ancient diseases. In 1955, near about 10 days after independence, National Leprosy Control Program was launched. Why control program was there? Because till then leprosy was a public health problem, and the primary aim was to make it, that is, it will be no longer a public health problem. So at that point of the time, the program was control program. In 1983, National Leprosy Eradication Program started. In 2005, it was the milestone of leprosy elimination eradication, because at that point of the time, leprosy was declared to be eliminated at national level. And in 2006, DPMR, once we are eliminated, once we are progressing, then we have to scale up the measures, we have to scale up the system, so that we have to go beyond. Disability prevention and medical rehabilitation got introduced as a very important component of this program in 2006. On 31st December 2005, prevalence rate was recorded as 0.95 per 10,000 population. 10 is more there. That is 0.95 per 10,000 population. And for leprosy, it is considered that one case per 10,000 population is considered to be it as a public health problem. When it is 0.95, then it was considered to be no longer it was a public health problem. As I have already discussed, that is objectives. First, that is the elimination of leprosy. How to eliminate the leprosy? That is, elimination of leprosy means that is prevalence rate less than 1 case per 10,000 population in all the districts. Many districts are there where the prevalence rate still is more than 2. Second thing is the strengthening of the DPMR services of the people suffering from leprosy. Disability prevention and medical rehabilitation. It has different parts, that is, patients have to be taught to regularly checking the hands, eyes and feet for the presence of any impending deformity or disability. Eye checkup have to be done, as in the class we have already discussed. Person will himself or herself will check for his acuity of vision by covering his one other eye periodically, and will check. Then for the hands and the feet, the person himself or herself will check if there is presence of any cracks, fissures, ulcers, any hypopigmented area, any if there is any burn that is not getting healed. The person cannot recognize when the burn injury have occurred, so that there are the features of the hyposthesia there. It is the case that we need to give in with the more attention. And this disability prevention and medical rehabilitation plays a very important part. Thirdly, the reduction of the stigma, as there are some system loss, that is the eye deformities are there, loss of the eyebrows, finger loss, that is a digits loss, or there are some non-healing ulcerations are over the different parts of the body. So the people become stigmatized. in the society, they are met as ostracized from the society itself. So, it is very much important for reduction of the stigma, and stigma reduction can only be done by the awareness generation. And for this, what are the strategies? That is the early diagnosis, prompt initiation and completion of the treatment. Completion of the initiation and completion. Initiation is much easier, but the completion, continuation of the treatment, sustainability, that is very much important. The person, and for the post-basal leprosy patients, it is considered as the 6 months treatment have to be finished within 9 months period without any drug interrupted time more than 1 month. And for the multibacillary leprosy, as the time duration is 12 months, so that it is that the 12 months drug therapy with multibacillary treatment have to be finished within 18 months without any drug interrupted more than 2 months duration. So, these are the our protocol for the drug treatment completion. Carrying out household contact survey. This is carried out by our frontline health workers, and one ASHA is given with the responsibility of 1000 houses. In those houses, the person will go, the ASHA person will go for the there is patch survey, simply patch survey. If there is patch, they will go simply to the house. They go simply, not will, they usually visit to the houses, and during their visit, they in a fortnight, they ask the person that if having any patch over any body part, and of course will examine the person. For male people, it is better to examine on the daylight, if not possible, or in case of the females, have to be examined in the good light inside the room. If the patch is present, all the frontline health workers, almost all the frontline health workers, including up to the ASHA level, also the Anganwadi workers, our ANMs are there, of course, they are trained so that we have the capacity. They are trained in the leprosy, detection of leprosy. At the primary level of the leprosy case detection, they are expert. And they go for the detection of the patient if there is any suspicion, and for confirmation they send them to the medical officer. Once the medical officer filled up the form and give it the confirmation for the leprosy, there is no special detection, examination or any investigation is needed. Then the patient will be started with the multi-drug therapy according to the classification, how many number of the skin patches and how many number of the nerve involvement. And for the contact survey, it is more emphasis is given for the multibacillary cases and child cases. Why the multibacillary cases? Because the multibacillary case, it is more indicating of the chronicity of the disease condition, because the patches take long period. If we find the more number of the multibacillary cases in a certain year or in a certain area, that is indicative that in this particular area our frontline health workers or we ourselves are not working well. We are not going to the community, we are not doing anything for detection of this leprosy. And the child cases are important also. Why? Because children themselves are not affected they are affected from one adult case. So, if there is one child case, then that means there are the 10 adult cases. So, for these two purposes, detection of the multibacillary and detection of the child cases are given with the more emphasis. And as being the most frontline, the ASHAs are involved for the case detection and treatment completion. For this purpose, there are some provision of some incentives for the ASHAs for the case detection. For each case detection, they are given with rupees 200, and on each patient treatment completion. Completion means total completion within the stipulated time period. Within 9 months for the POSI and within 18 months for the multibacillary, without any drug interruption of 1 and 2 months for respectively for the POSI and the multi itself. And if it is completed, then for the possibacillary the ASHA is given with 600, and for the multibacillary rupees 800. Maybe now from the December 2019 it has been rupees 1000 probably. and for the completion and for the taking the person for the reconstructive surgery, there is also provision of some incentives. For the person who is taking the reconstructive surgery, he is given with rupees 8,000 and the Asha, she gets rupees 1,000. And other strategies are strengthening of the DPMR services, IEC activities, that is the information, education and communication, that is IEC. Information, education and communication activities, they are the key for the behavioral change, and these are necessary for the self-reporting of the cases. Self-reporting is the most important thing. If we can make people aware and make people understand that leprosy is a curable disease condition, nothing to worry. If you get the treatment and complete the treatment within stipulated time, you will be totally cured. Then they will come with their patch within time. And then reduction of the stigma, that is not to make the person away from his family, away from his society. And then the intensive monitoring and supportive supervision. There are some special activities. First thing, that is we have discussed a bit, that is promotion of the reconstructive surgery. Observation of World Leprosy Day, which is observed on the last Sunday of January. Usually it is observed centering 30th of January. This 30th of January, remembering Mahatma Gandhi. And in August 2018, Lok Sabha amended the bill for the leprosy as ground of divorce and omitted. Previously, leprosy, patients suffering from leprosy, it was a ground for the divorce. Now it has been omitted. And one leprosy awareness campaign is there, that is Sparsh. That is for the reduction of the stigma and discrimination. Sparsh means that is the touch. That is for the leprosy awareness campaign and reduction of the stigma. Finally, this is the emblem for the leprosy. Not leprosy, it is for the National Leprosy Elimination Program. Each and every logo, program logo, have some meaning. As you have seen for the RNTCP program, there are the logo, that is half and half person. Half part is colored one and half part colored another, and hands are straightened. That is also having some meaning. Here it is, we are having this NLEP emblem, symbolizes the beauty and purity. Here you can see that is, this is a lotus. Lotus is held with a hand. It is the beauty and the purity in lotus. Leprosy can be cured and a leprosy patient can be a useful member of the society in form of partially affected hand. Normal forefinger representing the shape of the house. It is in the shape of the house. Symbol of hope and optimism in a rising sun. Here you can see the rising sun is here, and the emblem captures the spirit of hope, positive action in eradication of leprosy. So we have the hope that in very near future we will dare to have a leprosy free world. So this much for today. Thank you.